unsteady gait, and also the people with normal pressure hydrocephalus, they also have this unsteady gait and they have tendency to fall. And also any type of dementia, when the disease progresses, then they can have these neurological symptoms. So as a result of all these symptoms domains in a person with dementia, they predispose the person for multiple injuries. So there are studies which have compared the risk of injuries in people with dementia with normal population, and they have found the risk of injuries is high and the risk of injury-related hospitalization is higher among people with dementia than compared to normal population. And then when we look at the types of injuries, the suffocation or choking is one of the commonest type of injuries in people with dementia. And then the accidental falls, they have found that it is 2 to 8 times higher in people with dementia in compared to normal people of same age. And then accidental drug poisoning is again common type of injury, because these people with dementia, they forget things easily and they can't remember whether they have taken medication or not, and they go and take another dose. So this is a frequent type of injuries we come across with people with dementia. And then road traffic accident. Again, people with dementia, they have impairment in these, when they have impairment in cognitive domains, especially these visuospatial, then the executive functions. They may not be able to navigate themselves in the road. They can't find the road. They get confused with the routes, and they can't follow the road signs, and they may not be able to take right decisions, because driving is a quite complex task. And if we miss something, so we can end up in accident. So it's very important for us to have a sound functioning of all our cognitive domains to drive. Because of that, the people with dementia, if they are driving, not only them, but also the people on the road are at risk. Then we talk about the other type of injuries, is homicide and suicide things. The studies have found that people with dementia are at risk of being abused or really being killed. So studies have found that the people with dementia suffer 5 to 55% of times from abuse or suicide, whereas it is around 3 to 27% in general healthy population. So financial abuse, physical abuse, and emotional abuse are common among people with dementias. And then we talk about suicide and deliberate self-harm. We know the deliberate self-harm is actually less in elderly population when we compare the rates with younger people. And suicide, on the other way around, the risk of suicide in general is higher in elderly people. When we look at these rates in people with cognitive impairment, especially in people with dementias, we can see that at early stage, especially we'll see that a high functioning person, when he or she gets dementia at very early stage, the person may have insight and understanding about this disease and what is going to happen in future. In that case, the person may become depressed about the condition and may end up in committing suicide or doing any act to harm him or herself. But what happens when the disease progresses? When it comes to the moderate severe stage, their cognitive functions are impaired and they may not be able to think, plan and carry out any act to harm him or herself. That's why the deliberate self-harm and suicide risk is low in people with moderate to severe dementias. Other than these type of injuries, we talk about the fire accidents, burns, and also electrocutions. Think about a person with dementia who is still continues to cook using a gas cooker or electric cooker. So it's very common for them to forget to switch off the cooker. So it can end up in fire. Those are very common accidents that we have to pay attention if they still continue to cooking and using these electric appliances. So when you look at what are the specific risk factors which predispose these people for these type of injuries, we can see that moderate severe stage of the disease and living alone, having behavioral psychological symptoms, being a female and age between 65 to 74, and also having injury, history of injury within past 1 year are the predictive factors for further injuries in a person with dementia. So it's important for us to see as clinicians what we can do to prevent these injuries in our patients with cognitive impairment. The very first thing is to educate patient and carer. So we should inform them about the risk situation and also recognize the warning signs. So what are the things that we can cause injuries in these people, in what situations, and also what would be the safety things, safety intervention that they can do at home to prevent these injuries. The risk situations, for an example, the wandering. If the person is wander out of the house, especially at night, they are at risk of falls, road traffic accidents, getting lost, and also situation that we talk like driving, and if they have access to dangerous tools, weapons, and if they still engage in cooking, bathing alone, or if they live alone. Those are the risky situations that we had to identify and inform the family and patients. And then, in general, improving the cognitive functions can help to prevent injuries. So we know that there are several strategies that we can use to help with cognitive function. One thing is cognitive stimulation, doing tasks to keep the brain active. There may be kind of a number game, the word game, or there are different tasks and there are different manuals to do these cognitive stimulation therapy for people with dementias. Another thing is cognitive rehabilitation, where we do different activities to regain some of the lost functions. And then with the cognitive adaptation, in cases where we can't approach with cognitive stimulation or rehabilitation, we can use alternative interventions to mitigate the effect of that cognitive impairment. For an example, we can ask person to use reminders to remind them to take medications. So that is cognitive adaptation. So there are different strategies. We can get the help from the occupational therapist to plan these interventions. Then I'm not going to talk about the falls because Dr. Shihan nicely explained these aspects. So we will move to the next part. The choking. I told that choking is another common type of injuries with people with dementias. So there are several types of people with dementia who are predisposed to risk of choking. People who are having stroke, people who had already had brain injuries, spinal cord injuries, who are with Parkinson's disease, multiple sclerosis, ALS, cerebral palsy, and people with advanced dementia because they already have difficulties in swallowing. When we identify people with risk, we can get help from other professionals to get the swallowing assessment done. So for that, we can get the help of ENT surgeon and we can get the help of speech and language therapist, and they will give us the assessment and also the intervention. The other practical instructions that we can give for the families and patients are on the way that they should sit or hold head when they eat, important. And also there are other strategies to help with swallowing to make it easy and safely. For an example, eating soft food and drinking quite thicker drinks that will facilitate drinking. And then medication, prevention of medication overdose. There are simple strategies the families and patients with dementia can use. One thing is using a pill box. They can use a pill box to organize their medication rather than keeping them in separate bottles or covers. And then they can have a routine to help with taking medication. With the, they can use meal times to take medications. And also if they have we know that there may be multiple medications in different boxes when you open the drug cupboard of an elderly person. So, so many unnecessary medication may be there. So we can throw out those unnecessary medication and keep the relevant medication only in those drug cupboards. And also, if the person is always forgetting and the person is the one who is taking medication, so we can keep the medication locked in a safe place to avoid that person having access to those medication. And we talk about the driving. So it's important for us to identify the risk at the beginning of the assessment. So if the person is still driving, and if we have any concern about the patient's ability to drive in and meet with the accident, it's our duty to first inform the family and patient, to inform the driving license authority and do the assessment and see whether this person is suitable to continue driving. If the family is not going to do that, it's, as a treating clinician, it's our role, it's our duty to inform the driving license authority. And then at the same time, if there's any risk, we should advise the person to stop the driving if the person is not going to do that. So the family can keep the keys and vehicles away from the person. And the fire accidents. So it's important if the person is forgetting and forgetting to switch off the cooker, and if there has been multiple accidents, so they should stop cooking. So if they are going to do it, it should be done under supervision. And having fire alarms is another option, but it is not very common in Sri Lanka. So those are the simple strategies we can use to prevent accidents in people with dementia. I think as clinicians, so these are the things that we need to do during our initial assessment, and also do intervention during planning the care for people with dementia. Thank you.
Okay. Thank you, Dr. Malsha.